First tonight, SEIU Healthcare Minnesota and Iowa members at Mayo Clinic St. Mary's are celebrating a victory today. The three-person arbitration board announced their decision, which resulted in huge gains for 1,600 frontline healthcare workers. Our Maureen Dudley has the latest.
After more than a year of negotiations between SEIU and Mayo Clinic, they have now come to an agreement through arbitration.
We made some amazing gains here at the hospital in terms of wages, in terms of shift differentials, and some overtime rules.
For overtime, no SEIU member would be mandated to work 18 hours over during a pay period. CSTs will have increased shift differentials in line with other technical positions at the hospital.
This process has been brutal. I've never been through it before. It's never been this bad before, I don't think. And it's felt punishing.
Despite that feeling, SEIU members will see at minimum an 8% increase in wages for the first year of the contract, with increases for the second and third years at 4.5% and 4% respectively.
This is a 3-year contract, so this provides a ton of stability for us and Mayo. Has huge raises for us and back pay to last year as well.
Members will also be receiving back pay in amounts between $5,000 and $10,000 going back to when the contract originally ended in April 2024.
Now that it's over and all said and done, great. I really do believe that we got more out of going to arbitration than we would have if we would have kind of tried to just stick it out with the employer.
In a statement on the arbitration, Mayo Clinic stated, quote, "While we believe Mayo Clinic and SEIU would have reached similar results around key issues much sooner had SEIU allowed the bargaining process to continue, we are focused on moving forward with our shared goal of providing world-class patient care," end quote. With the arbitration over, the final details of the contract will be drawn up in the coming weeks. In Rochester, Maureen Dudley, KIMT News 3.
Mayo Clinic also stated, quote, "While it would be challenging to generalize the salary increase percentages without being misleading due to the reality that this contract represents so many different roles, what we can say is that the arbitrator largely adopted Mayo Clinic's wage proposal. It aligns with wages for SEIU represented staff at Methodist and how Mayo Clinic adjusted non-union wages over the last 3 years, with higher increases for staff earning $22 or less an hour," end quote. The terms of the new contract between SEIU and Mayo Clinic are in effect now. The contract ends April 23rd, 2027.